Hi, I'm Phyllis and I'm from Cardiothoracic Surgery, and I'm going to be speaking about the recovery of a post-open heart. During your hospitalization or prior to it, you should have received the Open Heart Patient Handbook. This handbook is full of very valuable information, and I urge you to read through it. Now, there are topics such as walking, there's topics of diet, there is topics of pain management, cardiac rehab, and also when to call the doctor's office and also when to go to the ER. What I mainly want to talk though about today is about what is normal recovery at home and what is abnormal recovery. Now there are 4 reasons I would like you to go to the ER. The first reason is if you cannot breathe. The second is if you have severe chest pain or chest pain that is similar to heart attack pain. The third reason is that you've got shortness of breath with a heart rate of over 150. And the fourth reason, if you get a severe headache accompanied with weakness and numbness in your arms and legs, go to the ER. Now, there are 3 reasons why I would like you to call our office. The first reason is if you have a weight gain of 2 to 5 pounds in 24 hours, or a weight gain of 6 to 8 pounds since discharge from the hospital. So this means you're going to have to write down your weight every day. Now the second reason I would like you to call our office is that you have oozing or discharge from your sternal incision, your right radial artery or left radial artery, or discharge from your leg incision. Now what we'll do, if you do have that, we're going to get a CT scan and check to see if there's pocketing of fluid. Now, if you remember, you did have chest tubes, and you may have 1 or 2 puncture holes either here in front or on the side. Those can drain, and I'm not too worried about those. But any drainage out of any of these incision sites, please call our office. The third is if you have a popping and a clicking. Now, if that happens, I want you to stop the movement that started the popping and clicking. If it continues, please call our office because we will get a chest x-ray and we're going to check to see if you've broken some of your wires. Okay, now what is normal recovery that often really worries people? Now, at the top of your incision, you may have a lump. This is soft tissue trauma that will resolve in time. Another thing that frightens people is they can have numbness and tingling that runs down their arms into their fingers or even their entire hand. Some people also experience hot and cold hands. This is from the surgical procedure. We had you retracted open, which puts a lot of pressure here within your arms and shoulder area, and that can result in a pinched nerve. Now, since I talked about being hot and cold hands, I think you're going to find that you may have a hard time regulating your body temperature. At one point you'll be hot, another point you may be chilly. The third thing that concerns people is that they can have some pain across their chest. Now, this is not like the pain that I mentioned earlier to go to the ER. This pain is caused from us cutting open your sternum and retracting. Now, if your doctor used what we called the artery behind your breastbone, he had to push and disrupt your muscle structure here. And so what you're feeling often is muscle tenderness. And what can happen is that you may have this tenderness up to even a year. So if you get that pain across the top of your chest, take your hand and just press across because you're going to find out that it can be muscle. Now, the third thing, or the fourth thing, is you may be more sensitive to your heart. Now, granted, you are, because we've done open heart surgery and you're more aware of your heart than ever before. But during the surgical procedure, that procedure can result in you hearing or even feeling your heart jump or flip around in your chest. If this happens, just know that this is normal and that within time, and in several months, you're going to develop scar tissue behind this breastbone. And so those sensations or the sound that you're hearing will eventually resolve. Now, the fifth thing that worries people is a term that's called neurological cognitive dysfunction. This is caused from the heart-lung machine. And what it is a breaking off or a microembolus that breaks from the red blood cells or your cellular structure passing through the heart-lung machine. And those little pieces of fragment go to the brain. Now, that can result in some short-term memory loss. It can result in some confusion. It can result in not being able to focus. Do know that it will resolve. Some people don't even have this effect. Others will have it maybe during their hospitalization, and others it may take several weeks to resolve. So those things are normal. Now what I want to do, I want to read something. I'm going to read it twice because this is very, very important. Daily, I want you to monitor your weight, your blood pressure, your pulse, and glucose if you're a diabetic. Please write them down and bring those to your post-surgical appointment. Page 16 of this handbook, there is a form that if you want to use that, you sure can. Now, because we've introduced a change in your medication, please take your blood pressure and pulse prior to medication, to your new medications. And then an hour after you have taken your medications, I would like you to take your blood pressure and your pulse again. If your systolic pressure, and that is the first number on your blood pressure, is 110 millimeters of mercury or less, please hold your metoprolol. If your pulse is 60 or less, please hold that metoprolol dose. The reason I want you to take your blood pressure prior to medication administration and an hour after medication administration is that it's going to give you a reference. It will tell you how this drug is affecting your blood pressure. So again, let me reiterate. I want you to daily weigh yourself, take your blood pressure, take your pulse, check your glucose if you are diabetic. Write those down and bring those to your post-op appointment. Now let me also state, if you find your blood pressure 110 or less, or your pulse less than 60, please call our office and we'll instruct you on how to adjust your medications. All right, now I want to talk about pain management. At discharge, you did receive narcotics. Usually by the 5th day, we are asking you to start transitioning to Tylenol. Remember, narcotics will constipate, so please use them judiciously. Showering. When you shower, we want you to use a mild soap. We don't want you to scrub your chest incision, your arm incision, or your legs incision. Gently wash them. And when you are rinsing, don't allow the shower to beat the incision. Let the water run over. Now, when you get out of the shower, I want you to use a clean towel to pat your chest dry. I want you to use another clean towel or hand towel to pat dry your arms, and another one to pat dry your leg incisions. Do not cross-contaminate with the towel. Now, do not use any lotions, creams, powders, or oils on any of these incisions. Please leave your incisions open to air. And if you are going to touch these incisions, please wash your hands. Your hands are the biggest source of infection. Now, diet. We want you to use moderation. In fact, the changes that you make, we want them to be a lifetime management for you. So that means we want you to reduce your sodium, we want you to reduce your fat, we also want you to reduce your refined sugars. So, increase your fruits and vegetables and your grains. Alcohol, wait until you see the doctor and ask if you're ready to resume alcohol drinking, if you drink alcohol. And certainly during the time period that you're taking those narcotics, don't take any alcohol with those. Exercise. We want you to walk only. And we want you to walk for 6 weeks, just walk. We don't want you to lift over 5 pounds. We want you at discharge to be walking about 6 times a day. And as the days go on, I want you to increase your length and increase your duration. Do know that we don't want you to drive for 6 weeks. After 6 weeks, you can drive, and you can also lift up to 10 pounds. And depending on the type of work that you do, we may have you restricted with your working until 10 to 12 weeks after discharge. So we'll keep in contact, and when you're ready to go back to work, I can help assess that, and we can then do all the paperwork necessary for you to go back to work. Also remember that the airbag in your car is your enemy. So please sit in the back seat for the first 3 to 4 weeks after discharge. Now, emotions. Emotions can run very high after cardiothoracic surgery or after any extended illness. And especially this is true for us that have not been ill before, and you have been in control of your life, and now all of a sudden we've taken control and we've put all this restriction on you, and you'll go home and your family will be reminding you constantly how to move, what you should do, what you shouldn't do. This can actually end up in some irritations from you, some frustration. Do know that at 6 weeks, when you get your driver's license back and you can drive, generally that feeling of frustration and irritability will resolve. This all has to do with coping mechanisms. And as I mentioned earlier, if you have not had an illness, a chronic illness, or have had some type of illness where you have not been productive for maybe 4 to 6 weeks, you do not have the coping mechanisms. And so I'm going to ask you, if you start feeling depressed and frustrated, you can always call me, or you can get a hold of your primary care physician and they can help you through that. All right, be aware that for you that have had a heart attack or you've had a sudden cardiac death, there is a sense of doom. And this can surface up to about a year after your surgery. If you get a new pain, if you get a new ache, you may think, is this the last time? Am I not going to survive this? Let me guarantee you, you are going to survive, but it takes time for you to become accustomed to your new body image. And since I've been talking a little bit about emotions, you may find too that your friends may treat you a little bit differently after open heart surgery because they're going to think you're frail. All right, now the next thing I want to talk about is sex. Now, rest assured that sex will not interfere with your healing or your recovery. What we want you to do is to protect this breastbone. So we want you to use a position that will not make this discomfort or put any pain or pressure on this breastbone. Now do know, if you take sexually enhancement drugs such as Cialis, Viagra, or Levitra, do not take those for 6 weeks after your open heart surgery. And you individuals, you men that have had your radial artery that we've used as a harvest material, do know you are going to be on a nitrate for 3 months following your surgery. Nitrates and sexually enhancement drugs, again, such as Cialis, Levitra, and Viagra, will cause a severe drop in your blood pressure. So do not take those drugs together. But again, let me emphasize, you cannot go without your nitrate. You must take that drug for the next 3 months following your open heart surgery. Now, the last thing I'm going to talk about is cardiac rehab. Now, your cardiologist, when you go back to see him about 3 weeks post-op, he will introduce or talk to you about cardiac rehab. And at that point, he probably will give you a referral. Cardiac rehab is a program that was developed to put you in supervised exercise, as well as your instructors will help you focus on recovery. And do know that this program is designed to help you to return to a normal functioning. Thank you for watching and listening to this. And one thing I do want to tell you, if you run into problems, please call us and we'll help you through those. Our number in our office is 509-942-3095. Thank you.